I've been able to speak to a number of patients who are considering connective tissue grafting, and I can compare and contrast to my experience during the pinhole technique, who may be weighing these two options and uncertain about which direction to take. In terms of my experience, I would say with the procedure itself, tissue grafting was much more comfortable. There was IV sedation. I was unaware of anything that occurred during the process. With the pinhole technique, I was awake. I was very uncomfortable. It occurred over a period of quite a bit more time, and the equipment I had to wear to separate the lips from the gums was really quite painful near the end. There was no problem at all with the procedure in the office with Dr. Nordland. Early on, I was able to return to a near normal diet, with the exception of some very hard, crispy vegetables and fruits. And I felt better. That wasn't the option with the pinhole technique. It was many weeks before I could return, in fact many months before I personally could return to a normal diet. It was a laborious, difficult process, and I'd like to save people from that, because connective tissue grafting is really the opposite experience. The staff at Dr. Nordland's office and Dr. Nordland himself are so kind and calmed any concerns I had, answered all of my questions. I did a lot of research. I made them answer a lot of questions, but it really was almost seamless. I experienced no pain at all, and I think that's really important. I could go back to my normal social calendar immediately, and people were not aware that I'd had the tissue grafting procedure. I could return to typical oral hygiene, and I'm someone who's always taken excellent care of my teeth. With the pinhole procedure, I wasn't permitted to do that for a significant number of weeks, and I was so insecure about what that meant, and was my breath fresh? That was not a concern at all with tissue grafting. So it was really seamless. Again, no pain, back to my normal life very rapidly, back to my normal food very rapidly. I just felt generally healthier and happier. I personally had some scar tissue, and I had inconsistent results with the pinhole technique. It didn't work all the way. It worked part of the way, which was great, but I was supposed to repeat that procedure. But Dr. Nordland, this procedure is amazing. He was able to eliminate the scar tissue from the pinhole technique, correct it, and my arch was fully corrected. Not only that, he could do my upper arch and my lower arch on the same day. So it was one and done. I really cannot recommend this procedure enough.